going to be your healthcare provider today. Okay, I'm now going to perform my hand hygiene to get rid of the chain of infection. Now, I'm going to take my alcohol pad and disinfect my equipment.
Before we go over the steps on how to take blood pressure, first let's answer a quick question. The first question is, what is blood pressure? Blood pressure is the force against the artery walls. Blood pressure is typically measured as two numbers: systolic pressure, which is the pressure in arteries when the heart beats, and diastolic pressure, which is the pressure when the heart rests between the beats. The normal blood pressure is generally considered to be below 120 to 80 millimeters of mercury. Now for the second question. How do we take blood pressure? This question will be answered throughout the video.
Alright, we're going to take our pressure cuff. Elevate your arm.
A lot of people question on why do we take blood pressure, and here's why. We take blood pressure to measure the patient's cardiovascular health. This indicates if the force on the artery walls are sufficient. If it isn't, it will result in not enough blood flow going to vital parts of the body, and this could indicate hypotension. The worst case scenario is that you have a CVA because of hypotension, which means that you have low blood in the arteries pumping to the brain.
Alright, palpate the area, find the brachial artery. Brachial artery has been identified. We're going to apply Alright, we're going to apply our stethoscope onto the artery. And now we're going to inflate the bulb.
Now what happens if the sphygmomanometer is applied incorrectly? Inaccurate blood pressure readings can lead to several adverse outcomes, including misdiagnosis of hypertension, unnecessary medication, and potentially dangerous undertreatment of high blood pressure. Now, what can happen if the blood pressure gauge is done on the same arm too many times? This could cause hypertension. Hypertension is a condition where the force of blood against the walls of your arteries are consistently too high. Some people call it the silent killer because it frequently has no noticeable symptoms, and it could lead to serious health issues like heart attack, stroke, and kidney diseases. What influences blood pressure? High amounts of sodium intake, low potassium levels, or stress is among many other factors that can affect your blood pressure. Therefore, it is crucial for you to get your blood pressure and be able to measure your blood pressure frequently. Now, for the steps we do to take blood pressure. After finding the artery, we will apply the blood pressure gauge around the upper arm 1 inch above the elbow and apply the stethoscope underneath the blood pressure gauge and onto the brachial artery. After that, we will release the pressure, twisting the adjusting screw right to release the air. After that, we will put the stethoscope in our ears and inflate the cuff with the bulb and stop at 180 millimeters of mercury on the pressure gauge. Additionally, we will rest our thumb and index finger diagonally and slowly release the pressure to listen for the heart rate, referring to the carotid sounds. Once we obtain the systolic sound, which is the first beat, and the diastolic sound, which is the last beat, often 60, we will fully deflate the blood pressure gauge and chart our reading